When you check in at the hospital, a clerk will get you registered and give you a wristband for identification purposes. You will then be escorted to the preoperative area and will be prepped for surgery. 1 or 2 family members are allowed to stay with you while you're in the preoperative area. You will have an intravenous line that will be used to give you fluid to keep you from getting thirsty and antibiotics to reduce the risk of infection. Your surgeon, anesthesiologist, and operating room nurse will introduce themselves to you before surgery and answer any questions that you may have. Your anesthesiologist will discuss the type of anesthesia that is best for you. The duration of your surgery will likely be about an hour for a total knee replacement and about 1 to 2 hours for a total hip replacement. Your family can stay in the surgical waiting room while you're in the operating room. Your surgeon will talk with them in the surgical waiting room as soon as the surgery is finished. If your family is unable to stay, then they should leave their cell or home phone number and the surgeon will call them after the operation. Once the surgery is finished, you will be transferred to the recovery room, where a nurse will closely monitor you for about 1 to 2 hours. Don't be surprised when you hear the beeping of the blood pressure monitor and feel a small tube in your nose that delivers oxygen. You may notice a monitor on your fingertip as well that measures the oxygen in your blood and squeezes being applied to the calf of each leg by a sequential compression device that prevents blood clots from forming in your legs. There may be a tube exiting from your dressing that drains a small amount of excess blood from your incision. Patients with a total knee replacement may have a machine that continuously and passively slowly bends and straightens their knee. After the recovery room, you will be transported to the surgical floor. With today's less invasive surgical procedures and rapid recovery rehabilitation protocols, you can expect to stay for about 2 to 3 nights in the hospital. While this may seem quick, most patients can walk, get up and out of a chair, and go up and down stairs within this time frame. We use several different methods to keep you comfortable after surgery. Through the first night in the hospital, you will receive intravenous narcotic medication. Depending on the preference of the surgeon, you might be given a button attached to a pump that you can squeeze when you feel sore to self-administer narcotic medication. The pump is called a PCA, which stands for Patient-Controlled Analgesia. It prevents you from getting too much medication so you won't overdose. Alternatively, you can ask a nurse to inject the narcotic medication through your IV. Some surgeons also use anti-inflammatory medications such as IV Toradol, which relieves pain with very little side effects. Those patients that had an epidural or nerve block from their anesthesiologist will find these blocks continue to relieve pain after surgery. Your nurse will frequently ask you to rate your pain on a scale of 0 to 10, with 10 being the worst. Our goal is to reduce your pain level to 4 or less. Keeping you comfortable enables you to work with physical therapy and move and walk on your new knee or hip on the day of surgery. As soon as you feel comfortable after surgery, you can resume drinking and eating. Once you are comfortable drinking liquids and eating food, you can take pain pills, and the IV narcotic pain medication can be discontinued. The transition from IV to oral pain pills typically occurs after the first night in the hospital. Some people do get a little nausea from pain medication, and if you do, your nurse can give you some medication to make you feel better. Avoiding infection begins with the administration of 1 to 2 antibiotics in the preoperative area about 1 to 2 hours before surgery. These antibiotics are then continued for about 24 hours after surgery. Frequent hand washing or use of a sanitizing gel by your nurse, aide, therapist, surgeon, and guests is important. Gloves will be worn when your blood is drawn, your IV is started, and your dressing is changed. When you're awake and thirsty, we will begin your diet with ice chips and then progress to clear liquids and solid foods as you tolerate. It's important that you are given food that you like to eat. Please let the nurse or dietitian know about your food preferences or any special requests that you have. You will recover faster and feel better if you eat your meals when sitting in a chair rather than lying in bed. After your knee or hip replacement surgery, you will be encouraged by your surgeon, your therapist, and nurse to be as active as possible. Our goal is to make you comfortable and then encourage you to get out of bed, to sit in a chair, and resume walking on your new joint as soon as possible. Quick resumption of these activities greatly lowers the risk of postoperative complications such as blood clots, pneumonia, bed sores, and urinary tract infections. You should find your rehabilitation with your physical and occupational therapist a rewarding experience because you will quickly master both walking and going up and down stairs. Therapy commonly starts on the same day as surgery. Beginning on the day after surgery, you will receive 2 to 3 therapy sessions a day, both individually and sometimes with a group. The focus of your therapy is to encourage you to do as much as you can and learn exercises to move your new joint, techniques to get in and out of bed, and learn how to walk about your room and floor and go up and down stairs. Be sure to let your nurse know when you need some medication so that you can do your therapy in comfort. It's best for you to get out of bed and use the bathroom rather than use a bedpan. Both the nurse and therapist are well trained to assist you,